Our next guest is Mike Maurer of Novant Health Rehabilitative Services. Thank you so much for coming today. It's a pleasure to have you.
Thanks for having me, June.
I know you've been here before, but let's remind our viewers a little bit about you, like where you went to school and your credentials.
Okay, so originally I'm from Northeast Ohio. I went to college in Western Pennsylvania at Slippery Rock University for my undergraduate. And then I got my doctorate of physical therapy at Youngstown State, which is in Northeast Ohio. Moved down here about 7 years ago.
So technically you're Dr. Maurer.
I have a doctorate degree, yeah. I kind of like the informality of just calling me Mike.
I know, but I should have introduced you as Dr. Mike Maurer.
It's okay.
You'll forgive me,
I will.
right? So tell me about your role at Novant Health.
So currently I work, and many of our staff work, in the outpatient facility in Charlotte as well as in the hospital. They have varying different roles in the healthcare spectrum, but I think splitting the roles between the two facilities really kind of helps diversify our provided services, as well as
It's a little more interesting.
Makes it interesting, keeps our staff sharp.
Yeah, that's great. How does your role, I know you've kind of answered this, but tell me what the difference is between inpatient physical therapy and outpatient physical therapy. How does that impact you?
So they're actually very different. So
Are they?
At the outpatient facility, we're treating more patients who have had a referral to physical therapy for things like chronic pain, sports injuries, those sorts of things, really trying to get them kind of at the end of the continuum of care, try to get them back to where they want to be doing the things they want to be doing. At inpatient or at the hospital setting here, we really kind of work within the interdepartmental team to evaluate patients, see the physical limitations that they may have, and really have discussions about what the next step should be in terms of discharge and any kind of facility they might need, or any equipment or assistance or anything like that. So we're really part of, like I said, that interdepartmental team working together to really provide that remarkable service for that patient and get them the things they need after they're done with the hospital setting.
So you probably start at the beginning, like how you get out of bed.
Exactly, yeah. So it really, on the surface, it looks very simple. We're getting patients up, walking them around, having conversations with them, and really just deciding, you know, are you strong enough to go home? Do you need assistance from family? Or might we need to consider other services after?
Well, they are different. I didn't really think of it in terms of that. How do you assess a patient and the steps you go through to come up with a treatment plan, a therapy plan?
So I'll kind of speak to the outpatient facility. So we really, it's all about communication and really just talking with the patient and finding out what their goals are. So some patients just simply want to be able to get up out of bed and kind of walk the dog. Other patients need to get back to sports. Pickleball's a big thing down here.
We've had this pickleball conversation all
yeah,
day.
and so it's one of those things where, you know, patients come in and they might be any kind of varied sense of an athlete, and we want to get them back to doing what they want to do, and we take a really personalized approach to that, and that's where, you know, we spend 45 minutes of that evaluation really talking with you about your, you know, concerns, your goals, and really diving into figuring out what exactly you need in that treatment plan.
So what part does the referring physician play in this? What are your interactions like with them, and do they play a part in that treatment plan? They
can. So typically we do ask that our patients do get a referral from whether it's their primary care or a specialist like an orthopedist, sometimes neurologists, just so we can kind of have an idea of who's also involved in their medical care. When it's coming from a primary care provider and sometimes from an orthopedist, usually when it's just kind of a first step in conservative interventions, we really kind of, they rely on us to kind of set that plan and decide what's best. When we're dealing with more post-operative care like shoulders or knees, depending on the type of surgery, there is certain protocols that we do follow based on what the surgeon recommends and what they feel is best practice. And it's more of a recipe. You can kind of tweak and change the little things, but there are hard milestones on things that you can and can't do. And we really work hand in hand with the surgeons in that respect to make sure we're providing the best care for their patients.
Yeah, so then As the patient goes through their therapy and their treatment plan, does the primary care or does the referring physician get reports on how they're doing? And
so the beautiful thing about Novant Health is we all work within one electronic medical record, so we can see any physician or orthopedic notes from any follow-ups, and conversely, they can see any of our daily notes. We do send reports back, whether it's a progress note or a reevaluation or whether it's your discharge note, to the physician so that they can kind of get an idea of where you're at and what our plan is going forward. And we typically do that around 4 weeks and every 4 weeks throughout the process.
I'm curious, what's the most common complaint that you see? Or there's so many of them.
So yeah, the population in Brunswick County is kind of unique, and so we're dealing typically more with those kind of middle-aged and a little older individuals. So you can have those acute injuries, like muscle sprains and that sort of stuff. But then we also deal a lot with the chronic issues like back pain, knee pain, hip pain. Shoulders is another very common thing.
Do you think the golf and what have you, the activity level of folks, they play a large role in that?
Absolutely.
Because this seems to me the folks down here are much more active than where I came from in Ohio and West Virginia.
Absolutely, yeah. So it's a great thing that everybody's really active because it keeps you kind of loose and limber. But there are some times where being too active can be detrimental to yourself. So that's why we say as soon as you start feeling something that doesn't feel right, you really want to get it addressed, because we have our best outcomes when we address orthopedic issues early.
Yeah, and then there's those weekend warriors or those weekend rugby players, such as yourself and some others that I know.
Occasionally we're doing things we shouldn't be doing.
At that age,
at that
perhaps.
age, yes.
But you can handle that, right?
Absolutely.
You guys can take care of that. I know that you've already spoken to the inpatient and outpatient PT part, but when the patient thinks they'd benefit from PT, where should they start? Should they contact their primary care, their orthopod, or any?
So we have great working relationships with everybody within the Novant system and outside. Typically, sometimes all it takes is a phone call, particularly if the patient has had success or had experience with physical therapy in the past. A lot of times the primary care providers are okay with you calling, asking for a referral to physical therapy, and as long as it doesn't sound serious, they're okay sending a referral even without an office visit, because it helps reduce the burden of care on their office as well as on the patient, because it expedites that process to get into the therapy clinic.
Absolutely. Well, Mike, it's been a pleasure as always to have you. Thank you very much, and I hope you'll come back.
Thanks for having me. I'm always welcome to come back.
Great.